Well, hello. Thank you so much for the gift of your time and spending time with us. I want to explain who the us is. I'm Mike Roberts, and I am joined by John George and Nicole Huffman from ACM. It is ACM because ACM stands for
Autonomous Case Management.
And they're giving us the gift of their time because we have a lot of things we want to discuss here, but I want to just find out a little bit about who you guys are. John, what is your title at ACM and how do you end up in that chair?
Well, that's a great question. Number one, it's Director of Development. So I'm out there both seeking new people to be a part of ACM Care, as well as seeking donations for our causes, since we have a charitable side to what we do.
And I'm going to come back to what that charitable side is in a moment. But Nicole Huffman, I have known you for a long time. When I first started in 2017, you were one of the nicest people and one of the first people that I met. But you're in this chair for a reason. So what is your title and what is your why?
Yes. So I am a program supervisor with ACM Care, and what I have been doing is medical case management. And the reason I got into this was really family related. I was driven into the nursing career field just by own personal experiences, and I wanted to help those. And I've been really drawn to seniors and adults, and came from a hospital setting into the community, and I've just loved giving back.
You mentioned personal experiences. Could I be so bold as to ask what those might be? Because you know what? It's very personal at this stage of life.
It is. So I have had a few family members who have had cancer, and I've watched them go all the way to end of life and go through those trials and tribulations. I've watched one of my best friends suffer immense migraines, headaches, and she kind of went through the hospital system of what was wrong with her and needed a lot of care. And I was just a teenager at the time, and I was able to provide that care for her and help with her siblings and be at the hospital by her side when she was really at her most vulnerable.
Well, I was married for 34 years to Ann Roberts, who's now in heaven telling Jesus what he needs to do next. But, but one of the things that I found out when Ann had cancer, because I was walking with her that whole way, is still there's a loneliness to it because I can sit right next to her in chemotherapy, but I don't know that pain.
No, you don't.
Right.
However, you do. You have an insight into it because of your personal experiences and now your professional training. Is that fair to say?
Yes, I will. I mean, I can only empathize with what a person is going through, but we have been through a lot of scenarios in personal life and in business where we can recognize that they're going through some difficult situations.
Thanks for being so candid. John, what's the inspiration behind ACM Care?
Well, with any non-for-profit organization, there's usually a need. And in this case, our executive director and founder, Julie Hess, 2 decades ago, realized that there was a need to keep people in their home if they were seniors, if they were disabled, and there needed to be a way for her to make that work. She found a great strategy, was able to put that together, and in doing so, the uniqueness of being a nonprofit organization, we obviously have private pay clients that Nicole and her team take care of. But on the other side of it, because we do that, it affords us to help veterans, veteran spouses, and low-income families that are on government assistance that would never get care coordination in a normal circumstance.
Well, let's stay there for a moment. How does that work?
Great.
I need care. I am a veteran, but I can't afford it. And everything I look at is some brochure that just terrifies me. But you're saying there is a way.
There is a way, and the great part about it is we will come out to their home and assess the situation with them, determine if there's something we can do to help, and see them through that situation at no cost to them.
Oh, that's amazing. You know, I have to say, I had no idea. Nicole, why is this type of care coordination so important to a senior?
Yes. So what we hope to do is we want to provide not only the senior, but their families with peace of mind. We are nurses, and so we're able to focus in on the medical component of care. We're able to assist them through that, help them weigh out their options, provide professional resources, trusted resources, and help them to remain independent and keep their dignity. It's a hard situation to be in, and we want them to feel safe within their own surroundings and feel like they're able to still function whatever that may be, whatever that function is.
Well, how do I know if I need the care?
Yes. So a lot of times it's family who reaches out, recognizing that their loved one is now struggling. Occasionally, the individual might realize there's some struggles going on, but it is very hard for that individual to admit or reach out seeking that help. So really, it's our families a lot of times that are just looking for something and looking for guidance.
I'm the dad. I've always told everybody in the family what they need to do. I take care of you.
Right.
You don't take care of me.
Right.
That is great most of the journey.
It is.
At the end of life, it's a big, how do you get over that wall?
It's a role reversal. The children are now becoming more authoritative, where the parents have always had that role. Sometimes that's a perfect situation to insert a professional like ourselves, because that kind of takes some of that burden off of the adult children, and that they can now look to this professional and seek out what their opinion is, and we can kind of be the bad guy in a sense. But we do develop relationships not only with the clients, the family, wherever their community is. We're there to just really help and guide them through their journey.
So you're like a part of the family, but you're also outside of the family, and yet really can see the forest for the trees.
Yeah.
So how do I know when I need somebody to come in from outside the forest and help with the trees, John? How do I know when ACM care is needed?
You know, you've got a situation where you're a senior, you're disabled, whatever the situation is, you're already there. And then something traumatic has happened. You've had major surgery. You've gone through rehab. You've had a loss of a loved one. And from that standpoint, then there's also the situation where the adult children have moved away. So now you're alone, and you have to assess that situation. You need someone to help you navigate through that. What are the next best steps that are needed for you to get through that situation? And we're here to advocate for them, to coordinate for them, whatever their medical situation may be. That's where ACM Care comes in.
I'm that family. My mother, some of the year she was in Michigan, some of the year she was in Florida, all of the year she was not listening. And I have a sister in Baltimore, Louisiana. I'm in St. Louis, and the rest of my family is in Detroit. I'm telling you, how do you deal with all of us who, regardless of the age differences, role differences, we all have in common that we're afraid? How do you help us?
Well, I will say this. Nicole had her personal situation, and I've had two wonderful careers. I retired. My wife said, find something with conviction. So after I retired, I went to work for the United Way, and I loved my time there. But I was reached out by Julie and the president of our board, Brian Clark, and they told me, do you want to get into the grassroots again? You know, there was a time 20 years ago where I was door knocking for Edward Jones. Do I mind going out and seeing people face to face again amidst what we've gone on as a community for the last few years as a country? And so I was so excited to do that. And the reason was I had a grandmother, a great aunt, and my mother, not necessarily in that order, spend 14 years in a nursing home. Now, I would tell you they all had different reasons, but the point is it taught me so much of what their needs were. And maybe there are times when they should have been somewhere else. But from that standpoint, it gives me a good perspective to help people that might be in that situation today.
Let me create a hypothetical. And let's say somebody just crossed paths with this video just because they're checking things out for their mother and father. There isn't a problem yet, but it's pretty clear that mom and dad are accelerating in their aging. We don't need your services now, but what would you say we might put into the folder? And maybe it's just the mental folder. What should we be thinking about now to make us less prone to the anxieties that show up when there is a big problem and it's coming at us fast?
Right. So I think in general, you just want to make sure you're being proactive. So that would be a perfect scenario. Maybe you're not in a crisis situation at this point and you're just looking for guidance. Even then, we could come in and evaluate what documents you may have into place, if you have any, potential resources we can tap into as they're aging. In general, a lot of our population is aging longer, but also they have a lot of comorbidities, meaning they're going to have a lot of health concerns. So, and with some of those, we understand that cognition could decline if you are having cognitive decline diagnosis. Your physicality with your lungs can decrease if you have specific diagnosis. So we can kind of look at what they have in their history, see what they have as potential documents and resources, and just help the family to kind of start on a good path of aging.
So two daughters are talking. Mom's not here yet, but I talked to that Nicole Huffman, and she said, this is what we should be thinking now.
Yeah.
You can have that conversation with them.
Yeah.
Let's say that I'm in a position where I'm a person of means, and I have been through several of these experiences, and I would just really like to make a difference, especially since I'm a veteran. Is there a way that I can make a contribution to your more charitable side?
Yes. From that standpoint, we do take donations. So if you were to go to acmcare.org, and you would find out that there's information there to reach out, they can call me. We can talk about how they'd like to do that. They could designate it towards a veteran or even to a low-income family situation. And I'd be glad to talk to them about that at any time.
I was a hospice volunteer for a long time. I'm telling you, I was shocked at the things people told me. And so I want to ask a fear question to both of you. I have a friend I refer to you who's just afraid of this stage of life and all that comes with it, and it's not something that they can confide with to their children. How do you deal with maybe that fear or some other part of the fear journey? Because it's a real thing.
Yeah. So we come in and we're just trying to hear them and listen to their concerns. Some of this is maybe the adult children may not be comfortable, or your friend may not be comfortable confiding in those children about these fears, especially because as a parent, you're used to a specific role, and so it's again that role reversal. So we can just come in and listen to where they're coming from and provide some reassurance with what we've seen in our own professional experiences, and just kind of be a listening ear and a guiding hand.
There's no question that there's always going to be that difficulty. We are in an age for our parents that they didn't want to share their finances with anybody. They didn't, because their parents came from the Depression. So they're very closed. They're also closed about what's going on with them. That is the wonderful part about ACM Care. I've seen it firsthand. You've got situations where the children would like to know what's going on. Mom and dad or dad go to the doctors, and they come back and they say, I'm doing great.
Yes.
But that's not reality. The great part of having Nicole and her team, they're registered nurses, they're allowed to be in with the doctor. Sometimes her staff takes them to the doctor. They're willing to do that as well. And then they're right there, they've got all that information, and they can act as a liaison between dad and the children. It just makes it smoother.
It occurs to me that we put courage and we put asking for help in too narrow a box. Like asking for help is a sign that you're failing, and courage is when you get in there and you do it all. But I think sometimes that being brave is surrendering to the need to be helped, and courage is going ahead and pushing the start button on asking for help. Well, John and Nicole, if somebody really does need to reach out to you and has overcome all of the things that come with this journey, including the fear that comes with it, what's the best way for them to reach you?
Yes. So just reach out to our office line, 314-293-0697.
Or is there a website?
There is acmcare.org.
All right. Nicole, John, it's been so good to meet you. We are talking with John George and Nichole Huffman from ACM Care in St. Louis. They are also an organization that has a nonprofit component to it, which you must learn more about. Thank you for the gift of your time today, and thanks for being with us.
Thank you.
Thank you.